For this morning.
Perfect song.
I better show some signs of stopping. 7 minutes. 8:53, 7 minutes in front of 9 o'clock today. You know what it is? It's all the cold medicine I'm taking. Get a little loopy. It is Gary Byron. It is Joe, the producer. It is you. And by the way, coming up after the top of the hour Fox News break, founder of the Red Line, a nationally recognized columnist who writes about politics and policy, Red Janke, will be with us just after the top of the hour Fox News break. In the meantime, let's welcome into the Daily Connerton Memorial Company interview chair. Here is a person, here is a name that it should be familiar to you. He is not only a renowned dentist, but my goodness, he owns, 15 Columbia Dentals all throughout the state. Let's welcome back to the show. It's been a while. Dr. Mohammadi, nice to see you.
Good to see you, Gary.
All right, so a couple of weeks ago, or was it last week or 2 weeks ago, the topic of fluoride came up. And it's even come up again this morning, whether it's good for you, whether it's bad for you. I figured, well, let's talk to a dentist. Of course, when you talk to anybody, it could be biased. It's slanted towards, someone's narratives that they want to push. But I know that RFK Jr., he's going to tell Trump that the U.S. water systems should not add fluoride. So I guess I'm going to ask you, is fluoride a danger in our water systems? Is there enough fluoride that could cause any harm to human beings?
Gary, first of all, thank you for giving me the opportunity to clear the air, because many of my patients, they keep asking the same question. And the matter of the fluoride now it become more of a political topic rather than the scientific topic. But me as a dentist and somebody being trained on that field, I can tell you there is no answer yes or no for it. The answer is yes and no. And in order for me to answer it for you, we have to put this in the historical context. The first time in the history in United States, back in 1948, in Grand Rapids, Michigan, they started to do add fluoride to the water. And the amount of the fluoride that they added to the water was 0.7 milliliter, which is a very small amount. And over the last 80 years, there have been many studies and shows that that amount of the fluoride is safe in the water. However, the reason that first of all they did that is because 20% of the people that they drafted for military service, they couldn't go there because there were a high carriers rate. So it shows adding the fluoride is in terms of reducing of cavities is effective. CDC announced that 25% reduction of the decay we see in the community that the fluoride added to the water. There is one Australian study even shows up to 29% reduction in the community. However, we're talking back in 1948, things had been changed. Fluoride also can be dangerous if we consume in the high dosages. Many of our food and drinks and diet also contain fluoride. For instance, so if black tea has a good concentration of the fluoride, and if a person, let's say, is pregnant and is a heavy drinker, likes to drink a lot of black tea and use the tap water, which contains fluoride, it may cause overdosage of overconsumption of the fluoride. So what happened in 1948, it might not be applicable at this time.
Is this story going anywhere? I mean,
what I suggest, this is my suggestion, that every community need to evaluate it comprehensively. there is not one size that fit to all. What it might apply today to New York City, it might not apply in a
So
rural
let me ask you this.
area in Idaho.
Doc, I'm running out of time. Are there
Yeah.
any drawbacks having fluoride in our water?
Well, the drawback, as long as we not consuming with other products that contain fluoride, and we overdose the consumption of fluoride, there is no drawback. But the question it comes in today's society, it may not happen. We might consume other products that contain fluoride besides the drinking water fluoride.
But there's benefits to fluoride, right?
There absolutely benefit in the fluoride. But like everything in life, there is a risk and benefit. Again, there is not one answer. Every community need to evaluate that comprehensively and decide if wanted to have a fluoride in their water or they don't want to have to have fluoride in their water.
What would be the consequences if the MDC woke up tomorrow and said we're not going to put fluoride in the water anymore? What would be the consequences? Would we know? And what would be the...
Well, a study shows clearly that the community that they have fluoride in their water, they have up to 25% less of carriers rate than the community that they don't. So it increased the amount of the decay. However, those studies also a little bit outdated because it's in today's day we have a fluoride toothpaste, we have a fluoride mouthwash.
Yeah, but I spit the toothpaste. I'm not swallowing the toothpaste like you would water.
Correct, but that does the same effect. Local application has the same effect. Yeah.
All right. You can find Dr. Mohammadi at Columbia Dental. You can find him online at columbiadental.com. 15 locations all throughout the state of Connecticut, including their main hub, which they do everything. The implant center, the whole 9 yards over in Manchester. Dr. Mohammadi, Columbia Dental, thank you so much for being with us.
Thank you so much, guys.
Top of the hour,
Thank you.
Fox News Break. When we come back, Red Janky will be